U.S. foreign assistance funding has caused significant confusion and disruption in community HIV prevention efforts, despite a waiver that allows for the continuation of life-saving humanitarian assistance, including HIV treatment. Our reporter Mari Camara tells us more in this report.
Addressing a press briefing in Geneva, the Deputy Executive Director of Unaids, Christine Steglin, a life-saving humanitarian assistance by the U.S. President's Emergency Plan for AIDS Relief, has issued a waiver which has caused a lot of people undergoing treatment who rely on U.S. aid and can still receive their medications.
The waiver should mean that 20 million people living with HIV that depend on U.S. aid for their treatment can continue their medication. That's 20 million out of the 30 million people living with HIV in the world. This response has been heavily dependent on U.S. government funds. 70% of all money for HIV comes from the U.S. government of the global response.
Deputy Executive Director Christine Steglin also mentioned that the United Nations Unaids has expressed concern about the confusion at the community level regarding the implementation of the waiver, which has led to disruption in treatment services and the impact on transport services in community health workers. She said the pause in funding threatens the closure of many health centers and the termination of outreach workers' contracts, leaving vulnerable population without essential support.
Still a lot of confusion, especially in communities, how the waiver will be implemented, and we're seeing a lot of disruption of delivery of treatment services, especially at the community level. The biggest interruption will be on community health systems, which all of you know have been at the center of our success to HIV. So, for example, in Ethiopia, we have 5,000 public health worker contracts that are funded by U.S. assistance, and all of these in all regions of Ethiopia have been terminated. And 10,000 data clerks, very important in Ethiopia, so that we continue monitoring and ensuring that people are on treatment.
The loss of these services, she said, will hinder access to critical interventions such as condom distributions, HIV testing, antiretroviral treatment, and support for gender-based violence. The Deputy Executive warns that the agency is not reauthorized between 2025 and 2029, and without alternative funding sources, there could be a catastrophic increase in AIDS-related deaths, potentially reaching 6.3 million. The agency is committed to ensuring that during the 90-day pause, individuals affected by HIV continue to receive necessary services. For Eyeafrica TV News, I am Mari Camara.